The Divergent Paths project is interested in exploring the links between neurodiversity in childhood and multimorbidity in adulthood. Multimorbidity is a term which is used to describe two or more long-term health conditions affecting the same person. This is challenging as it can make each individual health condition more difficult to treat. It currently affects around 1 in 3 adults in the UK, but the number of people affected is steadily rising. The term neurodiversity refers to the way that everyone's brains naturally work differently from one another. Around 1 in 7 people is neurodivergent, which means that they think, behave, interpret, and process information in ways that differ to most other people. In the right environments and with the right support, neurodivergent young people can go on to have bright and fruitful lives as adults. However, without the right support, they can also be at an increased risk of mental health difficulties, challenges in accessing education and employment, and other stressful events across their lives. There is research to show that each of these individual factors increases the risk of multimorbidity in later life. It may therefore be the case that neurodivergent young people are at an increased risk of multimorbidity generally, but whether this is the case is unclear because there has been no previous research exploring this. We will use information collected from a large number of people over a long period of time to explore the different paths that the health of neurodivergent young people follow. We will do this work alongside young people who are neurodivergent and their families to make sure that we are asking the right questions in the right way and that our answers benefit as many neurodivergent young people as possible. Overall, we want to understand if neurodivergent young people are at an increased risk of multimorbidity as they grow up, and what the genetic or environmental reasons for this might be. This will help us to better understand how we can reduce their risk of long-term health conditions in the future and support them in following healthy paths toward adulthood.